It was a gray and cold afternoon in New York, with rain incessantly beating against the skyscraper windows, creating a constant and melancholic sound. Inside Central Hospital, Dr. Michael Turner, a talented and dedicated surgeon, was preparing for a complicated surgery. He was focused, mentally reviewing each step of the procedure. Michael always knew that life in the hospital was unpredictable, but nothing could prepare him for what was about to happen. Max, his wife Emily's faithful guide dog, was restless. Max and Emily shared a deep bond ever since she lost her sight in an accident years ago. Max was more than just a guide dog. He was a family member, a loyal protector, and often seemed to have a sixth sense about what was happening around him. In the middle of the surgery, Michael heard an unusual sound in the hallway. It was Max barking desperately. Initially, Michael tried to ignore it, focused on the life in his hands on the operating table. However, Max's barks became more insistent and closer until the dog abruptly entered the operating room, leaving everyone in shock. Max ran straight to Michael, urgently tugging at his sleeve, his eyes conveying a clear message of distress. Something was terribly wrong. Michael, not fully understanding but trusting Max's instinct, asked his assistant to take over and followed the dog through the hospital corridors. As they ran, Michael felt his heart tighten and a growing sense of dread. Max led him to the emergency room, where he found Emily lying on a stretcher, severely injured and unconscious. The paramedics who brought her in quickly explained that she had been in a serious car accident. Max, with an almost supernatural instinct, had guided the ambulance to the hospital as if he knew exactly where to find Michael. Michael looked at Emily, feeling a mix of fear and despair. He always knew life was fragile, but seeing his wife in that state left him devastated. He grasped her hand, feeling the weight of the situation. Max, beside him, continued to show his distress, softly barking and trying to comfort Michael. As the doctors prepared Emily for emergency surgery, Michael noticed something strange about Max's behavior. The dog seemed focused on Emily's abdomen, which made Michael's heart tighten. He remembered recent conversations with Emily about their desire to have children, a dream that had been thwarted by several failed attempts. One of the nurses, noticing Max's fixation, examined Emily more closely and made a shocking discovery. Emily was a few months pregnant. Michael was stunned. She had planned to tell him the night of the accident. The news brought a new layer of urgency and fear. Michael knew he needed to save his wife and protect the new life they had longed for. The atmosphere was charged with tension and expectation. Max, even in his despair, seemed to know his mission wasn't complete. He remained vigilant as Michael fought a wave of emotions, preparing for what lay ahead. The tension in the hospital was palpable. Michael stood by Emily, feeling every second pass like an eternity. Max, by his side, remained restless, his behavior reflecting the urgency of the situation. The doctors quickly transferred Emily to the operating room, and Michael, shaken and emotionally involved, knew he couldn't perform the operation. Instead, he trusted his wife's life to his team of trusted colleagues, while he tried to cope with the gravity of the situation. As Michael stepped away to let the medical team work, he couldn't stop thinking about the unexpected revelation of Emily's pregnancy. After years of failed attempts and delayed dreams, there was finally real hope of becoming parents. The pressure was immense. He knew he couldn't fail, even if he wasn't directly involved in the surgery. His mind was divided between the professional need to stay calm and the personal fear of losing his wife and the baby he barely knew existed. The medical team prepared frantically, adjusting equipment and checking procedures. Michael stood outside the operating room, holding Emily's hand and whispering words of love and encouragement before stepping away. Max was outside the room, his barks echoing down the hallway, a constant reminder of the urgency and unwavering loyalty of the dog. The surgery began, and every movement was critical. The medical team, despite the overwhelming pressure, remained focused, guided by years of training and experience. The tension in the air was almost tangible. Each team member knew the importance of that moment. Suddenly, even greater chaos engulfed the hospital. Several injured people began arriving in the emergency room after a devastating fire in a nearby building. The situation was serious, and all operating rooms were occupied, including the one being used to save Emily and her baby. The doctors faced the pressure of dealing with multiple emergencies simultaneously. Amid the confusion, Max, anxiously waiting outside, started barking frantically. His barks were so insistent that Michael went to see what was happening. Max pulled Michael by the coat, quickly leading him to the emergency room where the new injured patients were being treated. The injured needed urgent surgeries, and the medical team was about to interrupt Emily's operation to handle the new crisis. Michael, feeling panic rising, knew this could be fatal for his wife and unborn child. The situation seemed desperate. Then an idea struck him. Inspired by Max's insistence, Michael knew he had to make a tough decision. With the gravity of Emily's situation and the discovery of the pregnancy, he decided to fully trust his colleagues operating on Emily. He needed to act quickly to save the other severely injured patients arriving from the emergency. Michael quickly set up an improvised operating room in the emergency room, mobilizing resources and teams to operate on the fire victims. The medical team, understanding the urgency and seriousness of the situation, worked tirelessly to stabilize the arriving patients. Thanks to Max's intervention and Michael's quick reorganization, Emily's surgery continued without interruption. Michael, aware of what was happening on the other side of the wall, felt a wave of relief and gratitude. He had never experienced such an intense and surreal situation. Max, with his intuition and loyalty, had once again made a difference at a crucial moment. The operation continued in an atmosphere of extreme tension. Every step was meticulously calculated, every decision made with extra care. The silence in the room was absolute, broken only by the sound of instruments and the calm and precise commands of the surgeons. The team, aware of the gravity of the situation, worked with perfect synchronicity. However, amid this forced serenity, an unexpected complication arose. Emily began showing signs of severe internal bleeding. The blood flowed alarmingly, and the situation became critical in seconds. The medical team entered a controlled frenzy, trying to stabilize Emily and stop the bleeding, but the blood loss was significant. Max, who was outside the operating room, sensed the sudden agitation and frantic movements inside. His barks intensified, growing louder and more desperate. Michael, who was helping in the emergency room, heard Max's anguished call and ran to see what was happening. Upon arriving at the operating room, Michael found a chaotic scene. The doctors were fighting against time to save Emily, but the bleeding was out of control. Michael felt panic rising inside him, but he knew he couldn't afford to lose his composure. He needed to do something, and fast. One of the doctors explained that Emily urgently needed a blood transfusion. Without hesitation, Michael offered to donate his own blood. He knew his blood type was compatible with Emily's. Quickly, he was prepared for the donation. As the blood was drawn and transferred to Emily, Michael felt a mix of fear and hope. He knew this was their only chance to save his wife and child. The minutes that followed were the longest of Michael's life. The medical team worked with precision, each movement calculated to stabilize Emily and stop the bleeding. Max, now calmer, watched everything with silent vigilance, as if he knew the situation was finally under control. Finally, after what seemed like an eternity, the surgery ended. Michael, exhausted and pale but with a relieved smile on his face, received the news that Emily was stable and the pregnancy had not been affected. He left the operating room and found Max waiting anxiously. Michael knelt down and hugged the dog, feeling a wave of gratitude and admiration. Emily was transferred to the ICU, where she would continue to be closely monitored. Michael stayed by her side, holding her hand and promising that everything would be fine. Max, faithful and vigilant, didn't leave Michael's side, as if he understood that his mission was not yet complete. The following days were filled with waiting and hope. Emily began to show signs of recovery, and Michael spent every possible moment by her side. Max, always present, was a constant reminder of the miracle that had occurred. Their story was proof that even in the darkest moments, hope and loyalty could light the way. Emily's recovery was slow but steady. Each small progress was a victory celebrated with tears of joy and relief. Michael knew the journey was far from over, but with Max by his side, he felt they could face any challenge that came their way. Together, they had overcome the impossible, and now, a new life awaited them. Emily and Michael, hand in hand, faced the challenges that arose in the following months. The pregnancy continued healthily, and Max's constant presence was a source of comfort and strength. When they finally welcomed their child into the world, they knew that every sacrifice, every moment of fear and uncertainty, had been worth it. Michael looked at Max, who was standing by the crib like a silent guardian. He knew that without Max, that moment might never have happened. Their story was a powerful reminder that loyalty and love could overcome any adversity, and that miracles happen when we least expect them. The family, now complete, found a new purpose and new hope, and Max, always vigilant and loyal, continued to be the silent hero who had saved their lives. The story of Michael, Emily, and Max is a testament that even in the darkest moments, unwavering loyalty and love can bring light and hope. Max, with his incredible instinct and dedication, showed that the bonds between humans and animals are truly powerful. Through his courage and fidelity, he not only saved lives but also brought a new perspective of hope and renewal to the family. Every sacrifice, every moment of tension and fear was overcome by the strength of love and loyalty. And so, their story remains a beacon of hope, reminding us that miracles can happen, even in the most adverse circumstances, when we have the faith and courage to face challenges together.